A proposed change on vaccine rules for children being considered by Oklahoma State Department of Health.
That change would remove an educational requirement for parents who want to refuse vaccines for their kids. KTEN's Kendall Kaler, you checked into this. These changes causing medical professionals some concern, and they're talking about what they believe is the importance of these vaccines.
The education requirement was originally put into place in 2020, but implementation was delayed because of the pandemic. Medical professionals tell me misinformation is largely responsible for the increase in vaccine exemptions in recent years.
Last month, the Oklahoma State Department of Health announced a new rule change. The change to the rule would remove an educational requirement for parents who want to refuse vaccines for their children.
By removing the educational component, Oklahoma is ensuring that most parents are receiving their vaccination facts from the internet, primarily social media.
The educational requirement was just put into place in 2020, but not due to the pandemic. The rule is now in question, and doctors want to make sure parents know the facts.
Children should not be subject to the suffering that preventable diseases can cause simply because their parents believe myths read on social media.
One popular myth parents read is that vaccines will cause their child to have autism.
This has been debunked by scientists, and countless studies have verified that there is absolutely no link between vaccines and autism.
Doctors tell me vaccines are the most widely studied improvements in the history of science. They also stress the risk factors of not vaccinating children.
Parents who deny their children vaccinations are putting not only their own children at risk, but they are also putting other children at risk as diseases spread easily in communities with lower immunization rates.
Denying children sound medical care can be considered negligent and should not be supported by the state. Our first priority must be to protect our children.
The proposed rule change is open for public comment through January 14th. People are invited to submit comments online asking the health department to deny the proposed change. If you would like to do this, you can find the link on our website at KTEN.com. Live in studio, Kendall Kaler, KTEN News.